Hello listeners, welcome to MHT Conversation. मेरा नाम राजिका है and today for the occasion of World Alzheimer's Day, I bring to you a conversation that is focused on Alzheimer's, on dementia, on types of dementia, and it's a small effort on our part to remember those who actually can't remember. इस टॉपिक के लिए we have somebody who is extremely skilled in the geriatric population. She's a fellow psychologist. She's done her clinical master's training. She is a certified dementia skills trainer and also a committee member at Alzheimer's Disease and Related Disorder Society of India. So, सबसे पहले, I would like to thank Miss Vishwa Modi to coming, joining us, talking to us. So, thank you so much, Vishwa, for coming and being a part of this initiative.
Hi Rajika, thanks for inviting. And I think this topic it's such a it's so close to my heart because the first ever organization I started working in was an elder care organization, and I think since then the journey really seems fascinating, and there's so much to learn. When you spend time with these elderly, so I'm really looking forward to this conversation today.
Right. I think we all are because this is a population that nobody really cares about. It's the truth of the committee. People will be working with children, people will be working with adults. But geriatric is one area where, we kind of lack in our knowledge, in how we deal with them and what to do. People are just so clueless, we don't know what to do. So, right. So on this day where we are celebrating Alzheimer's and we're creating some awareness about it, talking about it. So this was the perfect time to actually have you on board and talk to you about this, give us your expertise. So just a small thing. So I think we should start with exactly what is Alzheimer's. क्योंकि अभी हम गूगल करें तो बहुत बड़े बड़े टर्म्स आ जाएंगे. It's a neurodegenerative chronic disorder. It starts slowly, it's a gradual process, people will start remembering. So there's a lot of stigma, a lot of myths, exactly what is Alzheimer's, hota kya hai.
Exactly. So, I've heard people use these terms very interchangeably, Alzheimer's, dementia. Kab kaun sa term use karna? I think, people are really confused about this entire thing. But I think, let's just understand the difference between what qualifies as Alzheimer's, what could be depression, dementia. So, Alzheimer's basically refers to, it's a type of disease where there are different functions, that are affected, including the most common one being memory, attention. There are also some perception difficulties where people are confused as to where to go, what to do, how to probably even do their day-to-day activities like bathing, eating, dialing a phone number, learning new tasks. Whereas dementia, on the other hand, is just a set of symptoms, more like an umbrella term, jiske niche there are different types. And Alzheimer's being one of the most common type of dementia, and one of the most, highest sort of dementia symptoms are found in Alzheimer's and followed by different types.
Okay. So what are these common symptoms? What are the most common symptoms, that you have personally seen, or exactly how would we see, okay, this is Alzheimer's, these are the symptoms of Alzheimer's?
Right, absolutely. So, there is forgetfulness of either things in the past or things that are recently done. So right now when we are having a conversation and, if after 5 minutes, if I was someone who was suffering from Alzheimer's, would ask you again like, oh, but, can you just tell me again, like, where do you stay? Like, repetitive questioning.
Right.
And also, getting lost in familiar areas. So not having that sense of direction, having difficulty learning new information. So, probably it could be an electronic device, a kitchen appliance, or it could be a phone number.
Right.
Alongside, there are these other things like attention, that I can't focus my task on one attention on one task for a long period of time, and I'm just going to get distractible, fidgety, confused.
Right.
My speech changes. So like I just feel like I know that word, but I just don't know, like, I know what it looks like, but I can't tell you the name. So word finding difficulty. Or for some people, even if you tell them, okay, can you tell us what this object is? Can you name it? They have difficulty naming it. And even I think, deeper, the more higher order functions that are affected are planning, sequencing, so what comes after the other, taking decisions. Um, it could also mean, judgment related things that at times they don't even have insight into their own behaviors. That why is this happening? For them, things are like, okay, pretty normal. It's like after 5 minutes, it's again going to be the same thing, like, oh, but I haven't asked you this question. It's the
Right.
first time I'm asking you. Versus for us, it may look like, oh, but you just asked me this like some time back and I gave you the answer to it.
Right.
So these are going to be the more, cognitive level symptoms that are visible. Then there are a whole lot of other symptoms which are in the behavioral domain where I'm not going to probably, have um, the motivation to do new things, lacking interest in doing things, reduced drive, don't want to like talk to people or go into social gatherings because there is that underlying sense of embarrassment that what if I, ask the question multiple times or what if I forget? Like,
Right.
I don't want to feel embarrassed or low about it, right? And which is why depression then becomes a very common symptom that can be seen in the elderly population, where, especially for those who do have an insight into the forgetfulness, there's a lot of impulsivity, like haste. They for some people also based on the type of dementia, there could be inappropriate behavior. So just opening their clothes or the button of the shirt in front of people who, it may be inappropriate to do so.
Right. Right.
So yeah, these are the common symptoms, and of course, these symptoms differ in intensity, severity based on the stage where the person is at, and also the area of the brain that's affected.
Right. So it becomes very specific to different
Yeah,
people who come. Right.
absolutely.
So, what stages? Are there stages? Like, what are there stages to dementia, to Alzheimer's, and
Yeah,
how does it get diagnosed?
absolutely. So just to walk over the diagnosis part first, we have a whole lot of batteries, assessment tools to
Right.
understand the severity, and also somewhere help us understand as to what type of dementia it could possibly be leaning towards.
Right.
Um, it's also important to note that dementia is more, it doesn't have like a very sudden onset.
Hmm.
It starts also gradually and it's progressing also gradually with
Hmm.
so it's not like every day when you wake up the symptom has progressed.
Right.
It is, over a period of time where you start seeing these symptoms more prominently, and that's when you realize that okay, probably this is not like normal aging, but it could be something above that.
Hmm.
And after we do this assessment, we have like 7 stages of dementia, with the first one being no cognitive decline as such, like the person remembers, can focus, can do tasks. So it's absolutely normal, and we probably are at a cognitively healthy stage. The second one is very mild decline, where it's normal forgetfulness, which is often attributed to like normal signs of aging.
Hmm.
Where if you see someone who is above 65, 70, it's likely that they're going to start forgetting things, but it's not that prominent or significant to affect their day-to-day life.
Right.
And then we come to stage 3, which is mild cognitive decline. So it's like, modest cognitive decline from like previous levels of performance. So earlier, probably I would take, say, 10 minutes to do these tasks.
Hmm.
Today, I'm going to like probably now start taking 20 minutes, 30 minutes. And you actually notice that change, but
Right.
it's not too significant key, it's affecting my different domains of
Different.
life.
Yeah.
It's just taking me a bit of time to
Hmm.
figure it out. My speed of processing, my reaction time will have fluctuations.
Right.
But apart from that, it's not too significant. However, this stage then becomes the most important stage in the progression of dementia, because if we don't take precautionary measures now, it may progress very quickly,
Right.
right? So you will actually notice that okay, forgetfulness is increasing, as opposed to someone who is engaging in activities,
Hmm.
in to exercise their brain, their body, it won't be that fast and quick for them. The fourth stage is moderate cognitive decline, where different tasks like dialing a phone number, probably removing clothes from the cupboard, wearing the clothes, all of these functions then start getting affected. Where I need assistance, I can do it, but I still need someone to tell me how or what. Stage 5 is moderately severe, where a lot of confusion and forgetfulness happens in probably every 2 to 5 minutes, and it's very very prominent. That this is not something that is normal of the elderly to do. Um, and stage 6 and 7 are more severe cognitive decline, where a whole lot of the abilities in your brain start to get affected. Means just want to like sit in one corner, don't want to do anything. First, you don't understand, probably the ability to understand, comprehend is also diminished. So in such stages, like people just want to like be by themselves. But again, these stages progress based on the brain areas that are affected, uh, and accordingly you will also see the symptoms. So it's very important to go back to the test, paper
Yeah.
pencil test, and also brain scans to
Yeah.
understand the progression.
Understand. Right. So this sounds like there's like a lot of research that has been done
Yeah,
on Alzheimer's, and how there are so many stages, and the earlier you're able to detect it, the better would
yeah,
be, I'm guessing, the how we deal with it.
absolutely.
So Vishwa, is it curable? Like, this is some of the very basic questions that comes every time. That
Yeah.
is there a treatment for it? Is it curable? What can you do when you see these symptoms, when it's happening, it's getting diagnosed? Then what?
Since this is a neurodegenerative disorder, means it is not going to be curable. It
Right.
is going to keep progressing, keep progressing. However, what we can control then would be the rate of progression,
Right.
right? So how fast it's progressing or how slow it's progressing also depends on the sort of activities we engage in once we realize that these symptoms have started coming up.
Hmm.
However, there is a flip side to this, where dementia symptoms could also be because of any medication, any metabolic diseases, any other, physiological illness that could also have, symptoms of forgetfulness, attention deficits. But um, for now, there is no cure that's found, which is 100%, that gives you 100% surety that, acha, if you take this medicine, then you won't get or
Right.
you won't experience dementia. But there is extensive research that's been conducted on vaccines, on medicines, that help you detect this at a much earlier stage.
Right.
Um, so yeah, and I really hope that there is some cure found, and uh, that would really like help and be beneficial to a lot of people.
Right. Of course. Of course. One can always hope. Like, there should be. We are doing so much research. It is coming out, so we should be able to have something in the near future which might aid
Yeah.
this progression. So, if we come to the existing treatment on what is actually available and what can people do, so what is that like?
Uh, I think the existing treatment right now that's been followed, or that the elderly for the elderly that we use is more of cognitive stimulation. So what cognitive stimulation means is we engage the elderly in different enjoyable activities. That could be brain exercises, that could be relaxation, like just aromatherapy, or practicing light movements, art and crafts, gardening. So these activities are more multi-sensory in nature, where we are using the vision, hearing, touch, um, taste, sensation, and exercising the brain in a way to make sure that all functions are being exercised through different activities. And these are very it's not that we are trying to restore anything, or we are trying to teach them how to remember better. It's just that we are working more on emotional well-being, where we are working more towards factors like resilience, hope, optimism, making them just feel good in the moment. And I think, the best part about when I do elder care work is that the elderly don't, like, remember at times what my name is even, but they definitely do remember that, okay, you are someone who comes and helps me do the tasks which I possibly struggle with, or I enjoy doing, and I would want to do it now but don't know with whom. Um, so the idea is just that happiness, fun element versus preaching something or teaching them something.
Right.
I think that's a major difference.
Definitely. I think this is something that we all should also practice, no? Like in general, even if you don't, if your parents or your grandparents, they do not have Alzheimer's, they don't show these symptoms. This is something that we should in general also practice. Like having these small activities you can do with them, having these small, let's say, interactions that sometimes you can have. So it might just help and give them a, let's say, thing to do. Sometimes that's all we need.
Yeah,
Just like somebody being there, just playing around, thinking around, interaction. So,
absolutely.
Vishwa, there's a huge part of having a new neurodegenerative disorder is the impact it has on caregivers.
Yeah,
Because, like it just happens and then you don't know what to do. And let's say if your mother or your grandmother is having such a sort of a disorder, suddenly it's going to take a toll on your life as well.
yeah,
Added responsibilities come in, things happen, symptoms you have to take care of, small details you have to take care of. So how can caregivers make it, how can we make it easier for the caregivers to
right.
like deal with it, and also how can they make it easier for the person who's having the disorder? Like there's a whole chain that is going to be happening. So what should people do? What do you think?
Absolutely. I think that when our elderly, like people who have been responsible, the sort of members of the family that are so senior, experienced in their own ways, um, and when they start suffering through these problems, I think, as you rightly mentioned, it takes a toll on the caregivers, because somewhere they were the source of learning, they were the source
Right.
of you know uh, being there, a support, and now suddenly they are the people who you even want to reach out to for support, and they probably won't be able to give you that kind of care or affection that you're looking for. But um, and which is why at times when they're repeatedly asking questions, we, as I said even before, that we as people know that they have done it, but for them it's like a brand new question they are asking every 5 minutes,
Yeah.
right? Hence it's going to be very important that as caregivers we take note of our sort of stress levels, our irritation, frustration that's coming up, and the minute it starts coming up, it's okay to leave the context for some time. And it's again not about spending quantity time with the elderly, right? It's like the elderly probably don't want 2 hours, 3 hours, or 4 hours of yours. But even if you're spending 15, 20 minutes, but if it's rich in quality conversations or activities that you're having with them, I think that is sufficient enough to make them feel like, okay, I am being taken care of.
Right.
And at no point, do we want the elderly to feel like they are a burden on
Hmm.
us, right? Because I think most of the elderly feel, when they ask probably grandchildren or children to do activities for them, or, just to get them basic things, there's a sense of irritation that stems up like, I don't have the time to do it right now.
Right.
And
Definitely.
we then just go back to our tasks. But it's also going to be so important to make them feel wanted, nurtured, uh, and at times these caregivers feel like a whole lot of stress because of the role change, because now we are the responsible ones and we have to take care of our parents,
Correct.
um, which is so unusual,
Right.
in our day-to-day life, where suddenly when this change starts occurring. um, so it's going to be important for the caregivers also to have their sort of resources in place, unwinding, having their own set of relaxation activities that they are engaging in to, create that sort of a space for them where they are not overwhelmed with tasks. Reaching out for therapy also definitely makes a big difference, considering that the lifestyle that all of us are living right now is, there are going to be 10 things happening simultaneously, but slowing down and knowing how to, probably compartmentalize the time would be beneficial.
As you know, like just listening to you makes me feel that there's such a lot of change that we have to do. And being it from a caregiver's perspective, being it from the family member perspective, being it from the people in mental health field perspective, there are so many changes that we have to make. We have to adapt, we have to inculcate those changes. Like it has to be there, it should be a norm.
Yeah.
So on that note, Vishwa, what do you think that we as a society, how can we work towards, let's say creating acceptance for geriatric mental health, or just let's say creating awareness for these things? Alzheimer's, how I started, there are so many people who don't even know the difference
Yeah.
between Alzheimer's and dementia and general forgetfulness for that matter. How interchangeably do we use this? अरे अच्छा भूल गए कोई बात नहीं Alzheimer हो रहा होगा. And it's somebody who studied it and who's being a part of it is just so mind-boggling to listen to all this.
Uh,
So what do you think, what can we do as a society to actually just create some more awareness and acceptance?
First, I think would be using the terminologies very mindfully. It's not like if I'm forgetting I have dementia, but it's also important to note that if it's significantly affecting my different domains of life, such as my personal, my social, my work, my, marital somewhere, uh, that's when probably it's something that needs to be taken seriously, which is why, the first message out there would be, please do not use this word dementia very loosely or casually, because it it is a collection of symptoms that are more intense than we think they are. And the second thing, as a way of acceptance, I think it starts with us as individuals from our homes. With our sort of grandparents or parents, who are possibly into their 60s, or would probably start their 60s sometime soon. um, but I would also like to say that dementia can be diagnosed as early as around 30 to 35 years, as research shows. So taking care of self then becomes primary, by engaging in different tasks. But I think when it comes to acceptance, it's about understanding that this is something that's very real. It's not like the elderly are faking it or just doing it to trouble you in
Right.
somewhere, but this is something that's happening to them, which is very real and could happen to anyone.
Anybody.
um, so that would be one where we're starting from us and then spreading it to probably, if we find benefit in it, we would want to tell two more friends or family. And I think this chain needs to continue, where we continue psychoeducating people about what dementia is, and knowing that if we find anyone who is going through something like that, then guiding them to the right probably resource and a place where they could get the treatment and help for themselves. um, Having, I think, more information around, and of course you rightly said that there's so much research that's out there. We just need a lens to view those things with more compassion. um, and also, I think, probably taking out some time to read up
Right.
uh, would really help. And I'm glad that mental health today is doing this as a way of spreading awareness and information, because I think that's step one to acceptance.
Right.
um, so thanks so much for organizing this.
I think that is exactly, Vishwa, that's the whole aim behind having mental health today, because there is so much redundant information that is available. Even today, if you just Google something about any disorder or anything related to the mind, and you'll get so many different, websites who are telling you so many different things. And it, like, it doesn't help it. I feel it confuses people even more. That now what do I do? So that's exactly why we did this, getting experts like yourself to come and actually tell us what it is, and what can we do. So that's exactly what we aim for. And this is exactly what this conversation was about. So, we've almost come to the end of it. So thank you so much, Vishwa, for, giving us such good information about Alzheimer's in particular, and, like telling us all about it. So hopefully, if anybody listens to this, even if you learn one thing about the disorder and maybe read up a little bit more, our purpose here is solved.
Yeah,
So,
absolutely.
uh, you know,
Yeah, absolutely. I think change starts with one person, uh, and let's actually, take conscious efforts to work for the elderly, with the elderly. And there are amazing organizations across India doing wonderful job of, keeping this sort of the rich culture, which is, the elderly, uh, occupied in a very healthy way with different sort of, enriching activities. But again, it's not like only elderlies can do it. I think we also need to, cultivate that habit of having that routine, self-care routine
yeah,
for us, where we are exercising these different uh, parts of our brain to keep them healthy.
right. I think that is the advice I would also want to give to everybody. Being a practitioner, working with so many clients, we really have to take care of our own mental health and also our emotional health, physical health. And the earlier we start, the better it is
Yeah.
what I feel. Like there are so many different activities that are available. If anybody is listening, there are multiple resources and these small activities that are available on MHT store. Please do go check them out. There are so many different resources that are available all across the internet. Please do go check them out. Indulge in some nice, like mind enriching activities. It actually helps and you actually feel nice that, okay, yeah, we are smart enough to do this. So with that note, thank you so much, Vishwa, for coming, talking to us, telling us all about it. It was a pleasure having you here.
Thanks for inviting, Rajika, and I hope that this video is a start to once again begin the talk about elder care, and we as professionals do take steps towards creating a lot more awareness. So thanks a lot.
Right. Definitely. That's exactly. We're going to be holding you again multiple times to come and talk to us about,
Definitely.
come and tell us, talk to us about this. So, to all our listeners, this was it from our side on Alzheimer's Day. It's Alzheimer's Day today, so if possible, please do go spend some time with the elderly, talk to them. अगर reason चाहिए होता है, so this is a reason to start, is what we say. So do go spend some time and do let us know in the comments below if you like the conversation, if you did some activity, if something happened, you want to tell us about it. Please do go and let us know. We will definitely convey your messages to Vishwa as well. And I hope to see you guys soon. Thank you.